All right, guys. Welcome to Healthy Living Global. Welcome to Healthy Living Global. I'm your host, Educator Mike. Welcome to today's live streaming. Um, I'm here with another update to update you guys on some things you are expected to know. Of course, this Healthy Living Global, and our goal is simple: to make sure that everyone lives a healthier life. Right? That is our goal on this channel, so that every member of this family, right, every subscriber, um, will stay on the know, right, remain on the know, be aware of some certain things that is happening around you, right. You know how to handle some health challenges in a way that will help in your health, right? Help in your health promotion. So all these things will help you to live what a healthier life. So this particular channel remain committed to support you at whatever level, all right, to make sure that you are living a healthier life. So I'm health educator, the health educator of this YouTube live streaming. Now today, we're discussing a very important thing, very vital. Yesterday we did some discussions which we titled seven BP stability hacks. If you haven't watched the live streaming, you can go and search it and watch it. A very wonderful one. And with it, I believe anyone that having BP or that is not even having BP, that particular live streaming can enable you to gain total stability of your blood pressure, right? It won't be low, it won't be high, it will remain normal, right? If you have to follow the guidelines that I have listed in that live streaming. So today, I say we'll be discussing about best way to treat malaria in 2026, the best way ever to treat malaria in 2026. What is the best way to treat malaria? There's a lot of misconceptions as regards malaria treatment. All right, a lot of people, we say, okay, let me go with this one, let me go with artemether-lumefantrine, let me go with sulfadoxine pyrimethamine, let me go with chloroquine. Chloroquine works very well, and so on. um and so on. A lot of people have different impression as regards this malaria parasite. Some people even tell you modern medicine do not work anymore, that they will use agbo, which is herbs. They will use it to treat malaria. That's what works best as today. But in this live streaming, I'm going to list the perfect way to treat malaria in 2026 based on medical um, system, all right, which is approved by what WHO, World Health Organization. Now, to continue, what you need to understand when it comes to treatment of malaria, there is four rules that you are expected to work with, right? Four rules that you must work with if you are treating malaria, right? Number one is get diagnosed before treatment. Yes, which get tested. Make sure you test yourself for malaria before you start treatment, right? With that, it will enable you know the species that you are treating and know how you go about it, right? Even the severity, it will tell you in the diagnosis. There is two diagnostic method that is being used. You can use microscopy, right? They will get your blood and use microscope to check the plasmodium or any parasite, right? Malaria parasite um, in your blood, right? Be it Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, anyone that will check it and know exactly the species and how of handling it again. is by rapid diagnostic test. All right, to that for diagnosis. This one of which you just get the blood. All right, check the in rapid diagnostic test kit. There is space for blood and there is space for the buffer. All right, if you put the blood, you the drop of the blood, then you add the buffer, it will check if you are having malaria or not. There's always two marks that it will show, which one is control line and one is positive line. If you are seeing one in control and seeing one in the positive line, means the person is having malaria. If you see one in control alone, means the person is not having malaria, because the control is showing that what this test was carried out as recommended. So it's a real result. The result is okay. So if only one line shows, that's how it is. So number one rule is get diagnosed of this plasmodium. All right, all plasmodium, falciparum, vivax, and get diagnosed of this malaria parasite before treatment. All right, if you are having it, you treat it. If you are not having it, there won't be any need to treat it. Rather, you can just use intermittent prevention therapy like sulfadoxine pyrimethamine. All right, those ones work for what prevention purposes. Even if you don't have it, even pregnant women use it because of what we are in a country where malaria is endemic. Intermittent prevention therapy is recommended, right? So that is it. Now, number two of the rule that you must work with when it comes to this malaria, handling of malaria, is that please use combination therapy instead of monotherapy. All right, use what? Anti-malaria combination therapy instead of monotherapy. Now, combination therapy like artemisinin combination therapy, which is like artemether lumefantrine. We have dihydroartemisinin and piperaquine. All right, we have different combinations of them, right, that you can go reach out to and use it, that will work effectively. But if you go and use monotherapy, which is the one that have only one content, like using only artemether, it may not fight the malaria effectively as expected, because what the malaria is becoming more resistant by the day. So you need a combination therapy to be able to tackle it in 2026. All right, so use what? Combination therapy instead of monotherapy. So please take note of that. That is number two rule. Number three rule is that you must make sure that what you work with um, the dosing. If you are making the dosing, let it be according to the weight. All right, giving out the dosing, let it be what? According to the person's weight. For instance, some people that are weighing like 15 kg, no, let's say for example they're weighing something like 20 kg, right? And some of them can be something like can be, let's say, 9 years, all right? Or let's say those some of all these sorrow, right? Maybe we see them to be at, let's say, 8 years, all right? Weighing 5 kg, all right? You see, and which anti-malaria will you give this person? If you are to calculate it by the age range, all right, we say that from 4 years to 8 years should use artemether lumefantrine, which is a 2120. Should use 2 morning, 2 night for 3 consecutive days. All right. But in this case, now based on the weight, all right, you are going to give the person 3 morning, 3 night, because of what the range of the weight falls what in the people that's supposed to take 3 morning, 3 night for 3 days. So work with the weight whenever you are giving the dosing. All right. So that is what you must do in order to curb this anti-malaria consumers on the right thing that must be carried out. So let me list it again. I said number one, I talk about that whenever you are you get diagnosed, right, before treating this malaria. Number two, I said if you are treating this malaria, use combination therapy and don't use monotherapy. Of course, monotherapy is just the one that contains just a particular drug instead of combination. And number three, I say that if you are treating this, remember to work with the person's weight, right? And don't work with the age range, because some people may be overweight, and if you give them, the drug may not work in their system. So therefore, work with the weight instead of the age. Number four is what? Keep to the right dosage, all right? And as prescribed by the healthcare professional, right, which is number four. Now, if you are giving anti-malaria to use as a healthcare consumer, right, you go to the health center, you get yourself tested, and they say malaria is using a RDT, that is rapid diagnosis. All right, guys, welcome back. Welcome back to this live streaming. Sorry for the interruption. Now, Now, all right. So when the healthcare professional tell you, now the end of the malaria, you are going to treat it in such a way that it will go completely. Within the period, even though we are in a country where malaria is endemic, but this is the way by which you can treat it in 2026. I've listed 4 rules. Let me still do a recap again. I say number one, get diagnosed before treatment. Number two, make sure that you go for combination therapy instead of monotherapy. Number three, work with the weight whenever you are giving malaria, all right, instead of the age. Number four, stick to the dosage as prescribed by the medical doctor or healthcare professional. Now, let us dive into the approaches to the treatment. Number one is when you are treating a species like uncomplicated Plasmodium falciparum. Of course, digested Plasmodium falciparum. Of course, that is the most common ones that you see in Nigeria. All right, is most common everywhere. If you are treating uncomplicated Plasmodium falciparum, you need to know how the treatment approach that you must use. All right, whenever you are treating that, you make sure that you use what, just like we have listed before now, use what, a combination therapy. All right, if you use a combination. All right, so welcome back. Sorry for the network glitch. Now, you make sure that you treat it for 3 consecutive days without skipping a dose. All right, when you are treating this uncomplicated Plasmodium falciparum. All right, you use like artemether lumefantrine, and if you are to use a medicine like all right, you need to check the person properly. The person need to be checked properly before using such medicine. All right, because there's some certain medicine that is not recommended for people that are having what we call glucose 6-phosphate dehydrogenase. All right, is deficiency. Glucose 6-phosphate dehydrogenase deficiency. There's people that are having this deficiency of glucose 6-phosphate dehydrogenase. These particular people, they they get reactions from some certain type of anti-malaria, like primaquine is one of them, right? They get a severe reaction. So whenever you are treating malaria, you need to know the person's condition, right? Know the person's one is the severity of the malaria, and know if the person having glucose phosphate deficiency, or the person is pregnant, the pregnancy status, all right? All these things will give you a guide on how you are going to approach the malaria. But the common ones you see is this artemether lumefantrine and other combination that you are seeing. Of course, they are okay, but not recommended. Like this artemether lumefantrine and even the hydroartemisinin and piperaquine is not recommended for pregnant women, especially in the first trimester, right? It's not recommended, especially what you need to take note of this. So before you get this malaria medicine, before you start using this malaria medicine, it's important that all this need to be evaluated. Know how the medicine you can be able to tolerate before you get the exact one that can handle your condition and you get it treated. Now, when it comes to other species like Plasmodium ovale, Plasmodium vivax, all those ones are not that serious. All those ones, even complicated Plasmodium falciparum, is not that serious. So that one, all this medicine can handle it. That of other species, P. vivax, P. ovale, P. malaria, those ones, all this combination therapy can handle it. But what about severe malaria? When they're having severe malaria, all right, that is what you need to take note of and be very serious when it comes to malaria treatment. We see it as a common thing in our environment. This one will have malaria, that one will have malaria. So, malaria is endemic. Every month you go and get drug and treat malaria, even when you are not having malaria. All this is increasing to the resistance. Can we just work with a particular guideline? That's what I'm giving you in this video, the guideline on how to approach malaria treatment. I have said it, I say get diagnosed before treatment. If you know that you don't need treatment, go for sulfadoxine pyrimethamine for prevention because malaria is endemic, right? And leave the treatment alone to avoid the resistant strains of Plasmodium falciparum or even other species. Right? The reason malaria has become serious these days is because of the resistant strains. All right, we started from chloroquine, and another thing you need to take note of is what the history of resistance in your area. Right, the history of anti-malaria resistance. There is still a place in the world that chloroquine is highly effective because of what? When chloroquine was in use, it was not abused that much in that area. So because of the resistance strains was not produced in that area, so chloroquine in that area, right? So the species of malaria that is around that place is not resistant to chloroquine. So therefore, they can take chloroquine and it will work. But Nigeria as a rapid diagnosis test is something you can obtain in every health facility, and it's cheap. How is 1,000? You get yourself tested and know if you have to treat it or you have to go for intermittent prevention therapy. So all those things are important. Now, when it comes to severe malaria, and that's something we are going to discuss about at the end of the video, which is about the pregnant women. This is a special case, right? Now, when it comes to severe malaria, you are having a severe malaria. How do you handle it? If you have a severe malaria, of course, malaria anemia, shortage of blood. Malaria can cause seizure, all right? Those ones can be very dangerous and can seizure, can make someone to have seizure. Someone jerking and as if maybe the person having epilepsy, all right? So not knowing that it's just malaria parasite, all right? The thing can bring someone down and you begin to say, what is happening? What is happening? Not knowing that is what malaria parasite. So we need to take note of that. Know that. Now, in this severe malaria that is capable of causing anemia, is capable of causing is capable of causing anemia, is even low sugar level. All right, these are the things of which this malaria can cause, severe malaria. anemia, is capable of causing low sugar level, and is capable of causing seizure. All right, because ones is something you need to, as in, be very serious about. Be very, very serious when you are treating. And how do you approach it? Now, start with artesunate IV, which was intravenous infusion. Please, all these things is for educational purpose. Of course, if you want to receive any IV, you go to the health center, right? So that you do that or anything. So it's for educational purpose. I'm not saying you should buy it at home. You may not know how to administer it, and if you get any other thing, disclaimer, I did not instruct you to go and do it at home. All right, but I'm giving you a guideline on how to approach it, because this particular channel have what both providers and healthcare consumers together that will need to work hand in hand to combat some certain diseases. Start of what of the hospitalization. Right, if the person is hospitalized, you start IV artesunate at 0 hour, at 12 hour, and at 24 hour. When you take it that way, then um, you can fall back to um, like at methyl or the so that's what I expected to do. All right, that's what I expected to do. You take the artesunate at 0 hour, at 12 hour, at 24 hours. Then you come back and use combination therapy like artemisinin, combination therapy like at methyl. If you're having a low sugar level, as thought of that, you may need what some intervention to make sure that the sugar level comes up, right, to avoid further issues. All those things is something that severe malaria can, even malaria ordinarily can still cause all those things, but severe one, just like the name sounds, severe is more dangerous and more deadly than any other, like uncomplicated plasmodium falciparum or P. vivale or P. malaria. So it's more dangerous than all those ones. Now, for the pregnant women, these are very special cases that need to be handled. For the pregnant women, it's recommended you use artesunate IV, right? Because of what this particular malaria in pregnancy can be very dangerous. It can even cause miscarriage, can cause shortage of blood, it can cause a lot of things to the pregnant woman. So you go with what artesunate IV, right? But hospital will guide you on that and even administer it and make sure that what to receive it to avoid pregnancy complications. So when you treat it within the period, let's say especially that first trimester, second trimester, if you like all the third trimester, they can just, if it's not that serious or it doesn't require hospitalization, they can just tell you to take at methyl. All right, all those ones can still go. So that is what we are discussing about anti-malaria for today. Remember these 4 rules I gave you. I say number 1 is that make sure you get diagnosed before treatment. Number 2, make sure you use a combination therapy instead of monotherapy. Number 3, make sure that you work with the weight, all right, whenever you are giving the dosing of malaria instead of the age. Number 4, make sure you stick to the dosage as prescribed by the healthcare providers. If you're able to do this, I tell you, with the guidelines of your healthcare providers in your area, you are going to track this malaria and get it treated perfectly without resistance, without other complications. Then that is what will happen. Thank you very much for joining us for today. See you guys tomorrow on the live streaming channel. If you have any question, put it on the comment section. We are going to attend to it. Share this video to people that you want them to benefit from this video, and I'll see you guys tomorrow by um, by 10 a.m. for live streaming. Thank you.